You've been diving into textbooks and videos, trying to wrap your head around a complex concept. Well, guess what? We're here to simplify it for you. Today, let's break down VQ mismatch, how air and blood interact in your lungs. VQ stands for ventilation to perfusion ratio. Ventilation is the air reaching your alveoli, while perfusion is the blood flowing through the capillaries around them. When both are balanced, gas exchange happens perfectly. Normally, we breathe about 4 liters of air per minute, with 5 liters of blood flowing through the lungs. That gives us a normal VQ ratio of 0.8, the sweet spot for healthy oxygen exchange. But when ventilation and perfusion don't match, oxygen can't efficiently enter the blood. That's VQ mismatch, a key player in hypoxemia during respiratory illness. There are 2 main types of mismatch: low VQ and high VQ. A low VQ ratio means not enough air is reaching the alveoli, but blood flow is normal. Think of airways blocked by mucus or inflammation, like in asthma or pneumonia. The blood flows through, but it can't pick up enough oxygen, creating a shunt. Now, a high VQ ratio means there's plenty of air, but blood flow is reduced or blocked. This happens with obstructions like pulmonary embolism, dead space ventilation. So, low VQ means not enough air, high VQ means not enough blood. Either way, the result is poor oxygen delivery to tissues. Clinically, these patterns look very different. In low VQ, like pneumonia, patients struggle to breathe, with crackles and low oxygen saturation. In high VQ, like pulmonary embolism, the onset is sudden, with gasping and chest pain. Oxygen saturation drops fast, but oxygen therapy helps because air is moving fine. Lab findings show low oxygen pressure, but the AA gradient is increased. That's VQ mismatch. In low VQ, chest X-rays may show fluid. In high VQ, CT scans reveal perfusion defects. Let's put this into perspective with a patient scenario. A patient with heart failure develops pink, frothy sputum and crackles. Classic low VQ. Treatment: oxygen, diuretics, and reducing fluid overload. Now picture a post-op patient who suddenly becomes anxious and short of breath. Their oxygen saturation drops, but lung sounds are clear. That's high VQ. Treatment focuses on oxygen, anticoagulation, and stabilizing circulation. In ARDS, both ventilation and perfusion fail, causing severe hypoxemia. These patients often need mechanical ventilation with PEEP and precise oxygen titration. Now, let's simplify it with an analogy. Imagine a restaurant. Ventilation is the waiter bringing oxygen, and perfusion is the customer waiting for it. If the waiter never shows up, but the customer is there, that's low VQ. If the waiter keeps coming, but there's no customer, that's high VQ. When both are present, everyone's happy. That's normal gas exchange. For NCLEX and clinical judgment, remember this. The normal VQ ratio is 0.8. Low VQ means shunt, low ventilation, blood still flowing. High VQ means dead space, air present, blood missing. Both cause hypoxemia, but only high VQ typically improves with oxygen therapy. Always treat the underlying cause: infection, fluid overload, or clot. So next time you see a patient struggling to breathe, ask yourself, is it a ventilation problem, a perfusion problem, or both? That question can determine how fast that patient recovers. And there you have it. You've just mastered VQ mismatch, where air and blood must meet for life to continue. If you found this helpful, like, share, and subscribe to NCLEX Map, your trusted companion for mastering nursing knowledge, one concept at a time.